Welcome to Friday Focus, February 3rd, 2017, and I'm going to talk to you about a new program we're rolling out to help our patients. We started the dermatology and we started a couple offices. Right now we're really just at Shelby, but we're still a dermatology practice, and a lot of things we do are, at Shelby in particular, is dealing with skin cancer. And at the other offices we deal with, signs of aging that occurred because of environmental exposure to the sun and even the fluorescent lights that damage our skin. And what about like prevention? How much prevention we're doing? People coming in to resuscitate things. If we're treating skin cancer, what about preventing skin cancer? With the hormones, we're trying to prevent certain cancers and heart disease. What about the skin? When we're treating, resurfacing the skin with Fraxel, we're treating a condition that's occurred, but what about prevention? Well, your main prevention is going to be in your topicals. So we're going to introduce a new program. We're going to have a system that you can talk to your patients about very easily that's going to give them a significant benefit of their skin. With the topicals, we've got this new brochure here, and you'll have it at your office. It's got the results that we're going to expect to see. And on the inside, it tells you the ingredients that are included in this package. So there's retinol, vitamin C, glycolic acid, green tea, resveratrol, Embolica, CoQ10, zinc oxide, phytostem cells, caffeine, white tea, fruit and vegetable, root extracts, and hyaluronic acid. And these are all combined in different products that help reduce problems with the sun. And we're going to guarantee the patients that they're going to have better pigment in 4 to 6 months, better blotchy and mottled pigmentation by 25%, tactile roughness and texture 25%, skin tone, evenness and clarity 15%, fine lines around the eyes and cheek 20%, overall sun damage 15%, and that's based on scientific studies showing you that this system reduces that. And the real reason I want to reduce this is not so much for the fine lines and appearance, but we're going to cut down skin cancer, okay? Because topicals are shown to block damage from the sun, and sunblock specifically used every day substantially reduces your risk of getting skin cancer. So instead of just treating skin cancer, we're going to block it. Instead of just treating photo damage or sun damage, we're going to work on prevention. And we really should expect all of our patients to participate. And we made it really easy for them. We guarantee it. Okay, if they buy this and use it for 4 to 6 months and they're not happy, they can bring the empty containers back. We'll give them their money back. It won't have anything negative on us. We'll get the money back we'll get actually the product reimbursed from the company that makes it. That's how comfortable and confident they are that this is going to work. So 100% guarantee, it's on the back. It's $259, and I'll tell you what it is. Number one, in the morning, and you grab your folder, you can see the different products. And we'll talk about how you can do this. We're putting the green tea cleanser in the morning. Okay, so the green tea cleanser in the morning. Vitamin C in the morning, because vitamin C protects you from sun damage associated with decreased elastin, which is elasticity in your skin, and collagen. So you want the C in the morning, and then the sunblock. Now they can use the spray, or you can substitute with the cream, whatever the patient wants. You must tell your patients to make sure they use the sunblock every day, because a lot of times people think they don't need sunblock because it's not sunny, but the fluorescent lights that are overhead, they're leaking ultraviolet light, okay? And studies have shown if you block the ultraviolet light with sunblock and with these topicals, you will get photo repair, okay? So the sunblock's got to be used every day. If they don't use it, they're not compliant with the system. Then at night is the glycolic cleanser, the retinol, vitamin A, which is makes you sun sensitive, you use at night, and then the face silk. Now, why the glycolic at night? Sometimes people get a little red from glycolic, so they've used it at night, it won't be noticeable. If somebody says the glycolic at night and the retinol at night irritates their skin, just have them switch these two, okay? The other thing is, when you have these different products, we did put different percentages on here. Like it's got 15% CRS, vitamin C, and 5x retinol. If you think the patient needs, because you're more experienced, thinking they're stronger vitamin C or a weaker one because they have sensitive skin, or same thing with retinol, just switch it. If you think they want cream rather than the spray sunblock, you can switch it. The only thing we don't want you to do is like switching like a retinol for vitamin C or sunblock for vitamin C or vice versa. If they want something else, just sell it to them. In fact, it's a good opportunity for you to sell them other things that they want that'll help their skin for condition specific. But regardless of the skin type, regardless of the age, regardless of their sex, this will make their skin look better in 4 to 6 months, guaranteed, and it'll reduce the chance of getting skin cancer. We're selling this for $259. It's over $300 if ordered separately. We're going to separate this out from your product bonus for a specific reason. First off, now you have an opportunity to sell other products, because when you get people on something, they'll want to do other things for their skin. When people look better, they want to do more. And secondly, we're going to change the product bonus, particularly in regards to this, to an office-based team approach. Okay, that way everybody from the front desk to to the back office, to the assisting teams, to ultrasound techs, to the estheticians, can kind of be involved with that. So I'll roll that out in the next few weeks. But this time this is going to be excluded from your product bonus because I want you to sell this for the office production, and we'll build the bonus back into the office. That way it's kind of fair for everybody. I'll make sure that 100% of our patients get this. And the real key is to impact our community. And if we want to reduce skin cancer, we got to start with like everybody in our practice getting exposed to this. Eventually we'll do an auto ship. Right now it's not there. Now we have two ways to kind of reasons for the patients to do this. Number one is to look better, which is positive. That's a positive behavior consequence. Number two, it is certain. And how do we know it's certain? We guarantee that they'll look better in 4 to 6 months, and it's going to be immediate. It's going to be 4 to 6 months versus, let's say, talking about reducing the chance of skin cancer. That's kind of uncertain, remote, and negative. So we talk about the positive immediate benefits. And we're going to be rolling out to your offices and bringing out some paperwork that you can use to kind of talk to your patients about it. There's really an opportunity for us to introduce product lines, like professional skincare product lines to our patients. They're not going to reduce their chance of getting skin cancer, but also look better in 4 to 6 months. The other thing to keep in mind is that we have the ability to exchange things, so you need to use some judgment when you're exchanging things. But like, let's say they don't want the spray sunblock and they want the cream, that's fine, exchange that. You might decide that they're going to use a weaker vitamin C and somebody's got a little sensitive skin, that's fine. The retinol, which is the vitamin A, that might be something with somebody's sensitive skin, they're using it every other night versus every night on the onset, in a weaker strength for somebody with sensitive skin. But otherwise, when you're exchanging things, make it like products. Don't exchange, say, a vitamin C for a Nectapherm. And the other thing that's real important to tell your patients that we do want them using the sunblock, even when it's not sunny out, because the ultraviolet light from the fluorescent lights causes skin damage. And if you completely block ultraviolet light from your skin gets a chance to repair. So they really need to use all three of those. And if they're not happy with it, they can just bring it back. We'll give them their money back. We'll keep the products because we send them back to the manufacturer, get our money back. So thank you very much.